Our nurses are the backbone of your care at the center, and we have several different types of nurses to match your treatment needs. And today on Lunchtime Live at the center, Marci Bookal-Mundy, our Director of Clinical Operations, is here to talk about these different roles that our nurses play and how they are involved in both your IVF and IUI cycles. Marci, hello, welcome.
Hello, thank you very much for having me.
Well, it's lovely to have you here.
Thank you.
Nursing. What are the different nurses? What are the different nursing roles at CARS?
Okay, so nurses are one of the rock stars of our multidisciplinary team. They possess expert clinical knowledge. They offer a collaborative approach to nursing care. They systematically and continuously collect and assess data in order to provide individualized care. The nursing roles include clinical nurse, IVF, PACU, OR, third-party nurses, our advanced practice nurses, and our float pool nurses.
Oh, okay. So, how would that's a good number. So, can you talk a little bit about each of those nurses and what they do?
Okay, so we during the new patient visits, there's the patient intake. They review the diagnostic testing. They talk about the physician's plans. They provide guidance and they answer questions. Then we have the clinic nurses, and they do the low tech procedures, but they basically review and explain the treatment plan. They provide patient education and teaching. They order the medications, they assist with scheduling of appointments, they perform the intrauterine insemination, which is always very exciting,
Yeah.
and they offer support and guidance. We have the IVF nurse coordinators, and many of these roles overlap, but so some of the things that they do I already mentioned, but a patient has what's called a 1B appointment. The IVF nurse reaches out to the patient to review the IVF teaching booklet. They send out prescriptions, they assign the consents, but there's lots of focus on the actual coordination aspects of the treatment cycle. When patients are cycling or stimulating, patients are monitored frequently, so they expect phone calls regarding the dosing and when to come back for their next appointments. It's a two-way relationship. All of our nurses are patient advocates. It's important that patients feel supported as they take ownership of their treatment cycles, and our nurses are very pivotal in that particular process. The Then there's the third party nurses, and again, a lot of the same type of responsibilities. However, they help patients navigate the options for third party, whether it's donor sperm, donor egg, etc. And they offer lots of counseling, ongoing emotional support, compassion, and respect. Overall, oh, sorry, go ahead.
No, go ahead.
Overall, I'd say our nurses, they streamline the processes involved in patient care. They form strong bonds with patients, and they basically help patients as they undergo all the intricacies of treatments.
Okay. So if a patient were to come in in their new patient appointment, they
Mhm.
would be meeting with a clinical nurse?
Yes, yes, and well, yes, if the clinical nurse, and if it's decided beforehand, if it's known beforehand that it's going to be an IVF cycle, then they would meet with one of the IVF coordinators. It just kind of depends on the purpose of the appointment.
Okay, so if the purpose is to come in and if the purpose is related to IVF and their IVF treatment plan, they're going to be working with an IVF nurse.
Correct. Yes.
And when would someone be working with a clinical nurse? Are those appointments that lead to IVF or
They
vice versa?
can. So a clinical nurse basically handles the low tech type procedures. So if it's known that a couple is going to undergo maybe a intrauterine insemination cycle or maybe a timed intercourse cycle, something kind of low tech, and sometimes that's all the treatment the patient needs, or sometimes they'll try those type of cycles and maybe they're not successful, and then they transition to an IVF cycle or whatever type of cycle. Yes.
Okay, so an IUI, someone coming in, and you said that during IUI, it is a clinical nurse that does the actual IUI?
That's correct. Yeah.
Okay.
Yeah. Which is
Um,
very exciting.
it is.
Yeah.
So, and then for third party, for people who are doing donor sperm, donor egg, donor embryo,
Mhm.
um, the person that they deal with to advocate for them, is that the same person who would do the actual transfer and retrieval or the help with the IVF cycle, or is it
They,
separate?
yeah, a third-party nurse basically coordinates the treatment cycle, make sure that the patient's in compliance with some of the, let's say, FDA regulations and the selection process and that kind of thing. But the retrieval, where they retrieve the eggs, that's done in our procedure or OR suite, and we have a different team for that also.
Oh, can you talk about how the OR suite and the nurses that work in there?
hmm So basically, the patients provide pre-op care, interoperative care. So a patient, let's say, is going through an egg retrieval under sedation. We have nurses that manage that, assist with the doctors and the anesthesiologists. Then there's the recovery of that. Also, if a patient is having an embryo transfer, that isn't done under sedation, but that's also done in our suite.
And so when all of this is happening, when patients are in a treatment cycle, they usually will hear from their nurse. Is that every day? How often would a patient communicate with their nurse?
Well, the patient can reach out to her nurse at any time.
Okay.
But if a patient is undergoing a treatment cycle, the patient comes in for monitoring so that we can control the response to medications. So patients are coming in for usually blood work and ultrasound, and they can expect a call back from their nurse to let them know, if there's going to be a change in their dosage for medications and when they can expect to come back for their next appointment.
Okay.
But we are guiding the patients through the whole process. As you can imagine, it can be quite overwhelming. And so the nurses offer tremendous support and they're great resources for the patients.
Absolutely. There's such amazing, really high touch in
Absolutely.
um and how are the nurses divided? Is it specific to their patient's doctor?
Yes, yes. We do have team nursing. So we have each doctor has their own team of nurses, and those teams include medical assistants, financial counselors, and of course the nurses. Whether it's they usually have a clinic nurse and they have an IVF nurse.
Okay.
Yeah.
Okay. And um that's amazing. So
Thank you.
they do a lot of them. They do some wonderful things there. So is there anything else that patients should know about their nurse, prior to coming to the center or, while they're in the middle of treatment?
I think it's important for patients to know that all of our care is very individualized.
Mm.
It's not just a walk in the park for us. We are there specifically to offer that support for patients. We want patients to feel like they're part of the process, that we're not imposing treatment on them. We are assisting them with that process. So that very hands-on TLC, uh, um, we offer just lots and lots of support for patients. It's
Mm.
important that they realize that we're there for them, and that as they go through the highs and lows of treatment, we're right there with them, and we want to just be that extra that place for them to fall, or that place where they can celebrate as they go through this treatment process.
Well, and as one of the nurses said, in one of my another live, Jenny said, "We
Mhm.
got you."
Exactly, that's it. Exactly. Yeah.
And it's true.
Yeah.
So Marci, thank you so much for joining me and talking about this. And we will see you next time on Lunchtime Live with the Center. If you'd like to learn any more about this, please check out about us. Please check out our website at yukonfertility.com. And real quick, Sharon Levine said the nurses are amazing. True.
Absolutely. Thank you. We're a little biased, but I believe so.
Right.
Thank you very, very much for your time. Have a wonderful day.
Thank you. You too.
Thanks. Bye bye.